There's a cohort of patients who, as a GP, you kind of instinctively know something's not right, or something's, we know this patient is high risk. But the current services, there's nothing we can really quite slot them into. We're not bad enough to go into A&E today, but you don't want to wait the elective time for a routine outpatient. And that's where the CATS is perfect. It fits straight into that. The other aspect, I think, which CATS can do quite well is that there's a capacity to actually see patients at home. They're not just in Marlow, they can be elsewhere in the south of Bucks. And I think the advantage of that, you're seeing someone in the home environment, and that gives you a lot of insight as to what's going on. And I think more often than not, actually, in that role when I go and see someone at home, is actually, I'm just saying, you're doing the right thing. Yes, the patient may be elderly and frail, and the family of the concern, are they missing something here? And often not, it's just really just a matter of reassuring them and the patient that this is, what you're doing is fine. And again, that's quite hard to get on the standard NHS package. I think the beauty of the CATS service is because you've got the clinicians, either doctors, working very closely alongside the occupational therapists and the physiotherapists, is that we are often seeing them, assessing them medically, and that maybe was readjusting the medication, formulating or organising further tests, but also they've been assessed by the occupational therapists and they've been assessed by the physiotherapists. So one certainly has a feel when you'll see these patients, but not just getting a medical review, they're getting all the other reviews as well. And I think that's really where a lot of the difference comes from.
Well, I was getting very doddery, really, very doddery, and I was beginning to feel my age, which I hadn't done before. I just wasn't me, and I didn't like it. Didn't like it at all. I didn't ask to be 90, and I've got to make the best of it. They explained that I would see a doctor and a physiotherapist, at which point my heart quailed, but it was fine actually, and an OT, so off we went, and it was brilliant. And the OT lady came and looked at all the things I'd been complaining about, and one of the things was my downstairs loo. It was impossible, it was very uncomfortable, and I hated it, and I told her this. And she said, the seat is all wrong for you. I just happened to have another seat in my car, as you do, and she trotted outside and threw mine away and brought in the new seat. Now that has made one of the most important changes, and it's improved my lifestyle hugely.
Well, until I got referred to Marlow, I didn't even know it existed. I didn't know they would care, they would bother with an old person. They examined everything from top to bottom, checked the blood, the urine, the weight. From there, I was sent for several MRIs, the brain, the spine, and then I had to go over to Stoke Mandeville. They were ever so helpful.
Prevention Matters is a short intervention service, so we do up to 6 visits. And we can work with a client over 3 months because we understand, clients may go to hospital or they fall ill, so we're giving them 3 months to work with the client. And basically the aims of Prevention Matters is to try and keep clients independent in their own home for as long as possible. We look at lots of different things, social isolation. Does someone want to go out to a group? Because we understand that if someone's socially isolated, that can have a massive impact on their overall health.
I had my chemotherapy at Wickham Hospital, which wasn't too bad. I mean, they give you a parking permit, etc., but still, it's a bit of a trek. Coming to Marlow makes a difference because I can actually walk here. I don't have to rely on transport.
I was going to Wickham to have the injection. I do still get the blood test in the surgery, but then on the Thursday I used to go up to Wickham which involved, in our case, involves using a taxi, which eventually, gets quite expensive. But to have it here now is great because I only live down the road.
The biggest surprise is the reward that you get yourself from helping someone.
I think we started this service nearly a year now. It seems to be working quite well, and I think patients are also happy, the staffs are also happy.
The staff here are absolutely amazing. I really can't praise them enough. I mean, I've got to know them quite well because they've been with me for a year. I've been having treatment for a year, and they're amazing, absolutely brilliant, can't fault them.
Each time, even though they change nurses, they're all as kind as each other.
I want to stay at home. I live alone, but I have a lot of help, and I'm happy doing my own thing. It's given me a great deal of confidence that I was beginning to lack completely, and I think it has helped me hugely in all sorts of things, all sorts of ways.